And so the reason I brought up the previous group of slides looking at CYP induction and CYP inhibition is that when you start to combine several of these drugs, you can get toxicities and unfavorable side effects. And a good way or a good example of describing that is serotonin syndrome. We had talked about serotonin syndrome in several cases ago. I don't remember which case it was, but I just wanted to draw your attention to it because now we're going to be talking about a lot of the drugs that can produce this. And so the serotonin syndrome is pretty similar to the anticholinergic overdose, but the patient's typically sweating quite profusely, in fact. They're nauseous and they're vomiting. And so this is a really nice flashcard that I stole from the internet, and then there's the citation there. And you can see this is a typical patient experiencing serotonin syndrome. You can see cogwheel rigidity, tachycardia, sweating, of course, the grinding of teeth, hyperreflexia. She vomited already. And this really comes due to serotonin receptor agonism. And then, of course, there's the antidote right there. I do want to point out that typically the onset is quite abruptly, and she says here, my medication was increased 6 hours ago. That's one of the hallmarks of serotonin syndrome. Another thing that kind of goes along with this is this nice table that I also stole from the web, kind of describing the different types of syndromes that you'll see. I think for today, or for this lecture series, we'll just focus on these two. You already were tested on distinguishing between the antimuscarinic and the serotonin syndrome. And we already talked about malignant hyperthermia as well. And so we've actually done this whole table, but I think we'll review it again and probably one more time. And so the difference between serotonin syndrome and neuroleptic malignant syndrome really is the drugs that can be used to cause it, as well as the onset. And so serotonin syndrome typically occurs within a few hours of a dose adjustment. Neuroleptic malignant syndrome, a bit longer, usually days to even weeks. In terms of symptoms, serotonin syndrome is characterized by hyperreflexia, in contrast to neuroleptic malignant syndrome, which is characterized by bradyreflexia. And of course, if you look at the drugs, many of these are dopamine in activity. You can kind of guess where some of these movements or lack of movements are coming from. Other things that are step relevant include the treatment, and so we're not going to talk about this at this point because we haven't done a lot of these drugs, of course. Okay, so this is just a nice kind of a quick summary of serotonin syndrome, and learning objective 11 really kind of just wants you to distinguish between serotonin syndrome and neuroleptic malignant syndrome, just a kind of a cursory what can cause it and the onset of when these symptoms can occur. All right. So of course, as I said, we'll go through this whole table throughout the rest of the course, and I think we'll review it once more in the second year, just before your steps.